Yesterday, Burbank Mayor Constantine Anthony recited some medical talking points.
There's a three-word phrase that is used to diagnose kids who claim to be transgender. It's called persistent, consistent, and insistent. This is like medical professionals. When we look at it through the lens of a medical diagnosis.
So I'm here to set the record straight as a real physician and researcher. When a child has a problem with gender identity, at least 50% of the time, it is associated with a deeper-seated mental illness that is going to be treated with intensive therapy, not puberty blockers, not other medications, not surgery. The 2018 Clinical Practice Guidelines from the Endocrine Society say that you can add gender-affirming medicines if a multidisciplinary team, physicians, social workers, psychologists, not a school counselor, not a city council, not a city mayor, when a multidisciplinary team makes that diagnosis. And also when a child is able to give consent, which usually happens at 16. Anything younger than that will require the parents, so you do not shut out the parents.
If a teacher hears something, it's not their place to start informing parents.
This clinical practice guideline goes on to say that there are minimal data about starting medications on children younger than 13 and a half. When there are minimal data, that is considered experimental. And if you do not get consent, if you are experimenting on patients without their consent, that makes you a Nazi. Teachers should be partners and not partitions. The state should not be separating parents from their children. I've had enough. Parents have had enough. We've tolerated enough. It is time to act. I am Alex Balekian, MD. I am running for Congress in California's 30th Congressional District. You can visit our website, alexforca30.com. We need volunteers. We need donations. No contribution is too small. Join me in this fight. I cannot do this without your help.